Okay, bye-bye,
Take
everyone.
care.
Perfect. Thank you so much, Senator.
And we're going to continue on in the Zoom room where we have got Dr. Hoa Nguyen. Of course, as you all know, he's the former head of the Governor's Physicians Advisory Group.
On the road again.
There
Kind
he
of seems
goes.
like. Hey, Doc.
Hey, Jason. Good. Hi,
In the car, but not driving at
everyone.
the moment.
No, I'm not driving. No, I'm gonna. It's too dangerous, Sabrina.
That's good. So, thanks for coming on the show. First, I wanted to go through the new executive order, the new guidance that's out from public health, and your thoughts on it.
Oh, I'm glad that the restrictions have been lifted for some, but I still really wish that they dropped the mandate on the unvax versus vax on attending restaurant and gathering, all that kind of stuff. It's really sometimes it doesn't make sense, right? You cannot the unvax still cannot eat indoor in the restaurant. That's to me doesn't make sense, and but you still have indoor gathering, social gathering that max of 25, but vaccination status no doesn't count. So to me, in social gathering, there's no mask or no social distance. At least in a restaurant, you have social distance and you required to wear your mask if you walk around the restaurant, unless you sit down and eat. So things like that, it really, to me, it doesn't make sense still. But again, we are 90% plus fully vaccinated. Um, I think those mandate, those requirements should go away. Because we should all need to somehow adjust to the new norm. And also, people need to stay healthy and be able to go to the gym to work out. That's how we keep our comorbidity down and help our immune system in fighting the virus. So those things need to be changed. I'm not quite sure where we're going to draw a limit on when this thing going to end. But we cannot go on this forever. You know, uh, is that going to be next month, next year, or 2 years from now? But those restrictions should have a goal and a time. Right now, I don't think we have a set goal when we're going to remove those restrictions from the vax and the unvax. So I think that it's about time that we set the goal out there for the public to know what to do, when to expect those restrictions to be removed.
You've been part of the Physicians Advisory Group. You've made recommendations in the past to the governor, and when they hold these press conferences and they make these announcements and these restrictions, they always say that it's based on science. It's based on data, and so I'm kind of wondering where. When you were on the board, where do you get the science and where do you get the data, especially to make decisions like the ones we saw? Because, yeah, there's a lot of people who are kind of wondering, wait a minute, so I can have a social gathering at my house with 25 people and they could be vaxxed and unvaxxed, but when I go to the restaurant, you have to be outdoors if you're unvaxxed, but you could eat inside if you're vaxxed.
Mhm.
So,
Yeah. Early on the pandemic, when we make decision on the pack, we do a lot of reading to compare the studies elsewhere and what we do, and we base on the study to make this decision of how to do the restriction. But again, so at this point, as we know so much about this virus and all the study coming out, that's why I said we have to have a limit because right now, and then the goal for people to set, right? We set goal there, people reach it, but at this point, I think the decision at this point is not really based on data. I hate to say that, but again, if you're based on data, those restrictions should go away already. you know, so I think that the I hope that as the governor say that they will wean off this restriction every week, every 2 weeks, as the numbers show. But I think that the number already there, so we shouldn't be waiting for this thing for so long. Again, I think that limits and goals should be set very clearly ahead of time, so people and business can make decision. Right? That's how you. If you have a business, a private business like restaurant and gym and everything else, we have to have a goal, and we have to know when we're going to start changing our practice in order to survive in the business. But right now, there's no goals set out there, no limits to put out there. So people kind of guess every day of what to do. Just like the restaurant right now, the outdoor, they put everything away. Now they have to
Yeah.
spend a lot of money to put it back out again. It's really, it's very confusing and very costly for the business to operate and try to survive in this pandemic.
And we had a story last night about that very topic, and some businesses were saying, like, I'm not completely on board with the way this goes, because we're back to like square one of I'm having to like re-scramble and re-strategize how I'm supposed to operationally run day to day with these new rules.
Right, and there was
Yes.
also one other item in the guidance regarding vaccinations of 12-year-olds, right? 12-year-old and up, in order to
12-year-old in 1 month.
to participate in sports, whether it's contact or no contact. It's everything and anything, whether you play sports for your school or if you play sports in an outside league. And some people were actually very surprised, like they didn't know, because previously it was 16-year-old, right? Because I guess that's the age of eligibility to get the vaccination, and it went down to 12. But it kind of goes back to what you're saying, like, set some timelines, let us know. But it was like, boom, surprise.
Yeah, sport one is very tough. Now, we don't have much data on infection, on participating in sport. To me, anything that outdoor, like soccer, volleyball, anything like that, it can be outdoors, not a close contact sport like wrestling. Then really, you should encourage the young one to go out and participate. Really, despite any type of requirement. It's really hard to show any data to do that. I think, to me, those decisions should be removed and let the young one to play sport. At one point, we have restriction on participating in sport only in the school setting. Is different than outside. It's really, you can't segregate those two. They should be the same. So at this point, like I said, you cannot mandate again. The vaccination on children, and again, you should never mandate that on the children. Let that be the responsibility of the parents. So children should be allowed to play sports, to participate in a lot of stuff there, because it helped them stay out of trouble. I tell you, and it also help them being healthy. So we shouldn't put any restriction on the children on doing that kind of stuff. So, yeah, I mean, the pack have to really come together and really make the right decision, because again, we are 90% fully vaccinated. I know we're not fully protected, but again, our vaccination, fully vaccinated, is pretty high, one of the highest in the world. So we should be much more relaxed than where we are right now.
Doc, speaking of children, do you support the opening of all schools at this point?
Sabrina, yeah, the school need to be open face to face. Our children have been restricted their learning now for over a year, and they lost a lot. And I think that they should be able to go face to face in the school. The school are very good now and do the isolation, the contact tracing, and they learn a whole lot. So I think risk and benefit, to me, the benefit outweigh the risk at this point, and our children need to be, face to face and go back to their learning. Because again, we lost a whole year of school ready for the children, and learning online is not the same.
Okay, so because right now some of them are on cohorts, at least with the GDOE, you're saying bring them all back.
I would say that I fully support bringing our children back to face.
Okay. What about the new quarantine protocols? You have any thoughts on that?
You mean the travel and quarantine?
Yeah.
Yeah, I mean the travel quarantine. Okay, so there's so much confusion, and let me get it straight for people. Okay, there's a difference between U.S. citizen and foreigner. Okay, for foreigner, in order for them to come to United States and the U.S. territory, they had to be fully vaccinated. Okay, with the FDA approved and or WHO approved vaccine. Okay, there's very, very few exceptions, but the majority will be required to be fully vaccinated, and they had to have a test 3 days prior to coming to U.S. or the territory. That's for the foreigner. There's no exception in that one. For U.S. citizen that travel, you transit through Narita or you transit Honolulu to come to Guam, you do not have to have a test if you're fully vaccinated. If you're not fully vaccinated, then you need to have a test coming in to make sure that you don't have the virus. Now, if you live or you stay overnight at any foreign country, including Japan, when you come back into Guam, if you're fully vaccinated, you have to have a PCR antigen test 72 hours prior to arrival to Guam. Okay, if you are not vaccinated, okay, you can come into Guam, but you have to have a test 24 hours before you travel. That's the difference, is the time between 1 day and 3 days of the test, if you're fully vaccinated and you're unvaccinated. So that's the requirement this time. But if you go to Japan for a vacation or meeting and you're fully vaccinated, you have to have a test before you come back to Guam. It's not an or, you have to. Okay, so you have to be fully vaccinated and you have to have a test 72 hours before you come back. If you're unvaccinated, then you have to have a test 24 hours before you come. So that's pretty simple, but I think the EO kind of little confusion on that, and I have so many people on call and ask so I think I asked them to see if they can kind of clarify that a little bit. I know the public health guidance is a little bit more clear, but they still have a little bit of mistake on the public health guidance on the word and or.
Okay, so let me just go back through that. If you are a foreign national and you're coming to the U.S., coming to Guam, for example, you must be fully vaccinated.
Yes.
Right. If you
and a test,
a negative test. If you are traveling to or from Japan and you have a layover there for 24 hours and you're fully vaccinated, you have to have a negative PCR test at least 72 hours before arrival to Guam.
Yes, or antigen test.
Or antigen test. If you're not vaccinated and you travel through Japan and you're there for a day or so, or you're going on vacation or whatever it is, you have to have a negative test 24 hours.
Yes, you're correct.
Okay. Thanks.
We got it straight.
I did want to also ask, because we haven't heard a lot about it or discussions about it, and I don't think I've really seen it with the ARP, or it's been a while since we talked about CARES Act, right? But when the state of public health emergency was first declared and everything started to ramp up in response to COVID, there were these tier 2 and tier 1 clinics and so forth. I don't want to leave you guys out, but did you guys ever get paid?
That's a very sore thing. What we learned about this pandemic is that there's two entities, right? There's the government entity and there's a private entity. And I tell you, as much as we come into Guam, the government side fully subsidized with a lot of hazardous pay, 25, 15, 10% hazardous pay or whatever they call it for all the GovGuam employee that is frontline. But I tell you, from the private side, no, there's nothing coming out of it. And that's a shame, just because I tell you, this pandemic is not going to be the last one. The private partner, like the tier 2 and tier 1 and tier 3, play a big part on this pandemic, on the fighting of this virus and helping people in Guam. And I tell you, they are not compensated. No, they are placed on the pandemic emergency that require them to service everyone without the ability to pay or not pay. And all the tier 2, including GRMC as a hospital, put a lot of work and a lot of expense to try to comply with the executive order. But no, we didn't get compensated. We have a one-time federal grant of $250,000 since March of last year, and none of the tier 2 have been compensated for their work at all. So they're required to see everyone at no charge. As you can see, some of you guys come to the clinic, and we don't collect zero. And all that stuff have not been reimbursed by at all with ARP. We will continue to do that because that's our commitment to people of Guam, and we're not going to turn one away, especially AMC, SDA, and FHP. But no, we have not been compensated as required by the emergency order at all. So to me, I think that to go forward, some of this federal money should go to all the private clinic. Okay, not even tier 2, to kind of help them put together a plan of action and kind of refit the clinic somewhat in order for them to accommodate and see the sick patient, right? AMC, SCA, and FHP have a much larger practice, and I know I'm not speaking about AMC, but SDA and FHP, they spend a lot of money on their own to try to protect the patient and protect their employee on this pandemic. That means that they had to build an isolation unit. They have to build structure outside in order to accommodate to see the patient required by the governor to be seen in the clinic. But those are promised to be reimbursed, but so far there's no money go to those clinics at all. And to me, we spend a lot of money on room that sit empty in 2 months, millions, but we don't put anything on our healthcare system to improve in order for us to fight the next coming surge. So we kind of forget about private partner. We just take care of the government side. The difference is that if GMH needs money, we just pump more money in there. But we forget about the private partner. To me, they should go back and look at that. I don't think that we should be compensated to make any financial gain out of pandemic. All we need to do is make sure that we're able to provide a raise for our employee, okay, because they all are frontliner. I tell you, all my staff, I can speak for my staff that they are really work very hard, put their life at stake there, take care of the sick patient. And so far, it's very hard to kind of compensate them appropriately, just because as a private, just like any business in Guam, we are on the negative side in this pandemic, but then we don't have this, subsidized from the government on trying to abide by this order that the governor put out. So now we didn't get anything except the $250,000 at first. That's all.
Wow.
Even all the testing that the clinic does, we provide manpower, we provide the testing, the power, but there's no reimbursement anywhere to come in about the last 18 months. So,
Wow.
I think that it's just like everyone else, the frontliner and the private side have been left out and without any compensation or any type of reimbursement from the government at all.
I'm shocked, actually. I would have.
Yeah.
I mean, you saw the BBMR report. GRMC, they got money, and they're a private hospital, and kind of it takes me back to right before things ramped up, right before the governor declared that first state of emergency. There was a meeting with the GovGuam Medical Association. And the governor, I want to say that she said, like, when this public health emergency is declared,
I have the right to take over the
Yeah,
clinics. I was
yeah.
there. I was covering that. Yeah.
And so I'm
Yeah. I think that I'm not a lawyer, but she has the right to take over the clinic. But at the same time, you have to compensate the clinic for their manpower. That's for us, even in our practice, we have to modify a whole lot. The 4 room that we use now for isolation, we have to leave it empty throughout the day, because once we put a sick patient in there, we cannot put a healthy patient in those rooms. So those rooms sit empty. And like I say, you have to modify your clinic, cut down the number of patients you can see, just to save those rooms for the sick visit. That's something that we cannot change, because it protects our patient that is healthy, and protect our staff from getting sick. Those are stuff that we are, the tier 2, still are under the pandemic emergency order, so we cannot refuse to be seen anyone. The only time that we turn people away, because we reach our capacity already, we cannot go over that.
Wow.
When you go over your capacity, you create a lot of change for error and create infection on your staff. So the only way that we can turn people away when we reach capacity. But again, the pandemic, we go through this. We cannot go through this without the private partner.
Yeah.
I tell you, the private section play a big role, and on this pandemic, and so I don't know. Maybe one day that we will receive the compensation or the reimbursement, but so far, we don't receive anything. But again, for people, we still want to continue to do what we do in order to help our people through this pandemic.
All right, Doc. Thank you so much. We're up against the top of the hour. I wanted to thank you for coming on and sharing all your information with us.
Sabrina, can I say one thing?
Yes.
We really need to push the booster for people. Remember, you can be fully vaccinated, but we're not fully protected. And I know that UOG might shut down December 15 because the order have been expired. But the booster will be very limited to the northern and southern public health only. So we're going to the holiday. Please go out there. If you are vaccinated in April and earlier, or May earlier, please come in and get the booster, because you really need that to go to the holiday. We need to be fully safe, fully protected, to make sure that we keep our positive rate down. So people go in there and get your booster. It's not going to be a mandate to get the booster, fully vaccinated with 2 shots, so don't worry. But you need to do that, protect yourself and your family, okay?
Thank you so much, and happy Thanksgiving, Doc.
Happy Thanksgiving, Doc.
Thank you, guys. Have a good day. Okay, bye-bye.
The
Bye.
best gift you can give this holiday season is to keep everyone around you safe. So please get the booster, like Doc said, everybody.
All right.
I agree, Jason. Thank you, guys.
Take care.
Happy holidays, Doc.
Happy holidays.